The common clinical concern of hair loss can be a manifestation of various disorders. While the cause is straightforward to diagnose in certain instances, such as classic male pattern hair loss or patchy hair loss from alopecia areata, determining the cause of hair loss can also pose challenges. The human scalp contains approximately 100,000 to 150,000 hair follicles. The average person typically experiences the natural shedding of up to 100 hair strands daily. This process is integral to the hair's growth cycle, where new strands emerge to replace those that are shed. The primary cause of hair loss is often attributed to a condition known as androgenetic alopecia, also referred to as male pattern hair loss or female pattern hair loss. Androgenetic alopecia can manifest differently in individuals. Those with male pattern hair loss may experience bald areas forming on the front and top of the scalp. Individuals with female pattern hair loss typically exhibit thinning hair on the top of the scalp without complete hair loss. Another prevalent cause of hair loss is alopecia areata, where the immune system targets the skin areas where hair grows. Alopecia areata can result in small, round patches or larger areas of hair loss. Hair loss, whether temporary or permanent, can be triggered by hormonal changes and medical conditions. Factors such as pregnancy, childbirth, menopause, and thyroid problems are known to contribute to these changes. Certain medications and supplements, particularly those used for cancer, arthritis, depression, heart issues, gout, and high blood pressure, can have hair loss as a side effect. Radiation therapy to the head may lead to hair not growing back in the same way as before. Hair loss following a very stressful event is a common occurrence, often resulting in temporary general thinning of hair several months later. Specific hairstyles, especially those involving excessive styling or tightly pulling the hair, like pigtails or cornrows, can contribute to a form of hair loss known as traction alopecia. Diagnosing hair loss involves various approaches. While some cases, such as hair loss during chemotherapy, have an evident cause, healthcare providers often engage in investigative efforts to identify the underlying reasons. The diagnostic process may include inquiring about your family history, exploring instances of hair loss and their onset in relatives, reviewing your medical history, conducting blood tests to assess thyroid function and iron levels, scrutinizing the scalp for indications of infection, performing a scalp biopsy to examine for skin diseases. When hair loss is linked to factors like medication, hormonal imbalances, thyroid issues, or diet, addressing the root cause is often sufficient to halt the hair loss. Treatments for androgenic alopecia, which includes male and female pattern hair loss, typically involve medication. Initial treatment often involves over-the-counter medications like minoxidil applied to the scalp. Prescription oral medication, such as finasteride, is specifically approved for men with male pattern baldness. Hair transplant. This procedure involves carefully removing hair strands from a dense scalp area and transplanting them into areas with thinner hair. Platelet-rich plasma, PRP. After extracting blood, the provider separates the plasma and injects platelet-rich plasma into the scalp. PRP treatment can help slow hair loss and promote new hair growth.